Good morning, good afternoon. Hello, everyone. Welcome on our session from commitment to accountability to track commitment to accelerate progress for UHC. We are very happy to welcome you online today to open the UHC Day event side session that will probably be starting this week until the end of next week, and it's UHC Day happening on the 12th. I think we can now start over. You are most welcome to introduce yourself in the chat. Tell us where you are coming from, your name, your organization, and we're looking forward to have some news from you. Without further ado, I'm happy to let over the floor to my dear colleague, Amy, who is the director of CSEM and Management Health of Science, but I'll let her introduce properly. Thank you very much, Amy, and I let you over the floor.
Thanks, Laura, and hello, everyone. Great to see the numbers in the Zoom going up. Thank you for being here for today's event, From Commitment to Accountability, Tracking Commitments to Accelerate Progress for Universal Health Coverage, organized by the Civil Society Engagement Mechanism for UHC 2030. It's fantastic to see so many of you joining from around the world. I love seeing the chats popping up with your countries and cities, so keep it coming. Wonderful to be together with you as we prepare to celebrate International Universal Health Coverage Day on December 12th. As Laura mentioned, my name is Amy Baldasser-Bush. I'm a Senior Director at Management Sciences for Health, and together with my colleagues at MSH and at Wacky Health, I oversee the work of the Secretariat of the Civil Society Engagement Mechanism for UHC 2030. We call it the CSEM. Most of you probably know us, but we are the civil society constituency of the global multi-stakeholder UHC 2030 partnership, which works to build stronger health systems for universal health coverage. Our more than 800 members and 100 countries around the world advocate for policies that are inclusive and equitable, and to ensure that no one is left behind on the road to achieving UHC. And we welcome you to be a part of the CSEM and to today's conversation. Before we get into the exciting presentations and discussions for today, I want to share a few instructions about logistics to make the call as easy as possible for you and to encourage your participation. The webinar is being recorded, and we're pleased to offer simultaneous interpretation in Spanish, French, English, and International Sign Language, as well as closed captioning. All participants can and should select their preferred language now. If you look at the bottom of the screen, you'll see a globe icon with the word interpretation. We will have presentations today, both in English and in Spanish. So please go ahead and use that globe icon to select your language, English, French, or Spanish channels, or to mute the original audio if it's distracting you from hearing the interpretation. If you need technical support, please contact my colleagues in the chat box and they'll help you. In addition, you can also select whether or not you'd like to read the captions during the session. You should be seeing the captions automatically, but if not, you can select them by going to the CC icon on the bottom menu. If you wish to hide the captions, you can also use that CC menu to do so. These captions should be available to you now. They're only available in English. Again, please let us know if you have any challenges with accessing the interpretation or with hearing or anything during today's event, and my colleagues are standing by in the chat to help you. So, as you may know, this year's UHC Day theme is Health for All, a Time for Action. And this UHC Day comes at a critical moment, just 3 months after the UN high-level meeting on universal health coverage in September, and halfway to the 2030 end date of the Sustainable Development Goals. We all know that civil society will play a crucial role in ensuring that those commitments to UHC at the global, regional, and country levels are fulfilled. And we hope that the resources and the discussion we're going to share with you today will help you to do just that. According to the report called Tracking Universal Health Coverage, the 2023 Global Monitoring Report, which is released every 2 years by the World Health Organization and the World Bank, progress towards UHC has stagnated and even reversed in some countries, with a staggering 4.5 billion people still lacking access to essential health services, and an estimated 2 billion facing financial hardship to access health services. We know that the world is not on track to achieve the targets to cover all people and to stop or reverse this trend of catastrophic out-of-pocket payments for health. At the UN high-level meeting on universal health coverage, world leaders recommitted to achieving UHC by 2030. The political declaration that came out of that event contains important commitments, including on social participation, the healthcare workforce, equity, and other important topics. But the question is now, what actions are governments actually taking to fulfill those UHC commitments? And how can all stakeholders, including civil society, be involved in ensuring accountability for those commitments? With that all in mind, we've got a great agenda today for you to help answer those questions. You'll have an opportunity to learn about the key findings and recommendations from the State of UHC Commitment Review report, which is an important accountability tool you can use as you advocate with your government. We're also going to give you a brief demonstration on how you can use the data from the State of UHC Commitment data portal. Very cool country profiles for all of the UN member states. We'll show you how to use it so that you can track UHC progress in your country. And during the second part of the webinar, I'll be joined for a great discussion with an experienced panel of UHC advocates. We've asked them to reflect on the outcomes of the UN high-level meeting and to talk about how civil society is supporting the transition of those commitments, those global commitments, to concrete local action in their regions. We've got some fantastic speakers from Latin America and the Caribbean, from Eastern Europe and Central Asia, from West Africa and South Asia. And we'll wrap up with a few points on how you can get involved in UHC Day advocacy. And then we'll open up to your questions and comments. Feel free to drop your questions into the chat or the Q&A for our panelists at any time. Those will be monitored. Feel free to submit your questions in Spanish, English, or French. We will do our best to respond to them. With all of that said, I'll jump into introducing our panelists. I'll introduce them individually as they prepare to speak. And so I'm first pleased to welcome to the floor Dr. Shohei Akamoto to share an overview of key findings and recommendations from the State of UHC Commitment Review. Shohei is a technical officer at the UHC 2030 Secretariat, which is co-hosted by the World Health Organization, the World Bank, and OECD. He oversees the State of UHC Commitment Review, working with multi-stakeholders there. Over to you, Shohei, and thanks for being here.
Thank you very much, Yami, for a kind introduction. And good morning, good afternoon, or good evening, wherever you are. I'm Shohei Okamoto, a technical officer of the UHC 2030 Secretariat. So I'm really delighted to share the key findings from our State of UHC Commitment work this year. So as Ami a bit introduced about the background regarding the UHC progress, it has been stagnated for a while, and also in terms of the service coverage and also financial protection, the progress is far off track from our SDG targets. So it is really critical to once again ask the governments and political leaders to recommit to the acting on UHC commitments. So to complement this technical global monitoring report, we are working on the State of UHC Commitment work with multi-stakeholders, including academia, civil society organizations, and other UN agencies. The State of UHC Commitment Review brings a unique multi-stakeholder view on whether governments are acting on their UHC commitments. And it aims to support national review, accountability, and advocacy processes for UHC to ensure that achieving UHC remains high on political agendas at all government levels, to urge countries to take concrete steps to address their gaps in translating UHC political commitments into concrete action, and to hold political leaders accountable for universal health coverage. In terms of review processes, there are similar UHC review processes at different levels, which include reporting to the United Nations on their countries' SDGs progress, such as voluntary national reviews. The list of countries which countries reporting this year is already available. Unfortunately, there are not many countries which provide the space, but there are some countries which have space for civil society organizations to evaluate their SDG progress. So you may want to seek to engage in the process by using our tool and also findings from this State of UHC Commitment review. And our review work consists of two major products. One is countries profiles dashboards, which Waisowa will introduce after my presentation, and also synthesis reports, which are available in 2020, 2021, and also 2023 reports will be shortly available. The report is going to be published tomorrow. So the 2023 synthesis is based on a review of 153 countries since 2020. The full reports will be available on our UHC 2030's website. In addition to English versions, also we are preparing the French and Spanish translations. So please stay informed, and we will share with you the report once they are available. So it's a bit of the framework of our review. The State of UHC Commitment review is conducted along the 8 UHC commitment areas, which we presented with multi-stakeholders ahead of the 2019 UN high-level meeting on UHC. And this framework is also used for our UHC action agenda. And most importantly, these areas are in alignment with the political declaration of the UN high-level meeting on UHC. So to do the review, we use multiple information sources, including voluntary national review reports, national health policies and strategies, CSEM's country consultations, biennial shadow reporting, and also other quantitative data. So we use both of the qualitative and the quantitative data to conduct our review. So I'm jumping into the key findings of the State of UHC Commitment review. Overall, when we focus on the number of commitments toward UHC, countries' commitments to UHC per year almost doubled between 2019 and 2021. This was the following after the 2019 UN high-level meeting on UHC. However, after a few years in 2020, this positive trend stagnated and even reversed in some countries, setting UHC targets for 2030 further off track. And this is in line with the findings from the Global Monitoring Report on UHC. So it's really important for all of us to continue monitoring the universal health coverage commitments, to hold the governments and the political leaders accountable to act on their UHC commitments, even after the high-level meeting happened this year. So it's really critical to monitor the progress and also commitments. Also, another overall trend was found that when we see the UHC commitments across 3 dimensions of healthcare coverage, namely service coverage, population coverage, and financial coverage, or we can say financial protection, commitments relevant to financial protection are the least common. And it's really vital to have all types of commitments across all areas following the context of the country and also national priority. And given that the progress in financial protection has continued to deteriorate, more focus should be given for financial coverage and financial protection. So in each commitment area, together with the findings, we include ways forward in And these ways forward are based on the political declaration of the UN high-level meeting on UHC this year, because this political declaration has been adopted and agreed by member states. It is important for them to be responsible to act on what they have agreed. So that is why our way forward built on the UHC political declaration. So in the political leadership beyond the health area, although most countries acknowledge the significance of UHC as a goal in their national health policies, many fewer have translated their goal into tangible operational steps toward achieving UHC. And only around 20% of the countries which we reviewed have adopted the roadmap or a strategy for achieving UHC in their country. So it's really important for governments at all levels to determine their own national path toward achieving UHC. And it is also important to sustain national political leadership for achieving UHC. And ensuring to leave no one behind is vital for UHC. However, vulnerable individuals and groups continue to face financial and other structural barriers to accessing the health services and the commodities they need. As I mentioned earlier, financial protection is the least committed area, which is one of the causes of these financial barriers. And also some results from non-state actors consultations highlighted the lack of integrated comprehensive care, we can say primary health care, leads to a failure to meeting diverse population needs. So governments should respond to unmet health needs and also eliminate financial barriers as well as other structural barriers to ensure that everyone, especially those who are vulnerable, can access to quality, safe, effective, affordable, essential health services. Legislation and regulation are critical steps and actions to make UHC a reality. In our review, we found that while the majority of countries have made UHC a central goal in their national health policy plans and strategies, less than half of them have enacted UHC laws to ensure equitable, affordable access to health services. And governments should strengthen their legislative and regulative frameworks and institutions to ensure equitable access to affordable quality services to achieve UHC. And this should be done, including through the engagement with their communities and all relevant stakeholders, including you. And during our country consultations and review in the shadow reports, there were many concerns relevant to the quality of care. The global shortage of health and care workers, lack of support for the health and care workforce, as well as inadequate healthcare resources are challenges to providing effective, safe, people-centered care for all. So governments should accelerate action to address the shortfall of health workers and develop their own nationally costed health workforce plans by investing in strengthening national health capacity. Investing more, investing better for health. So despite the continued increases in overall health expenditure for the COVID-19 response, the current invest commitments by governments and also public spending for health, especially for primary health care, are inadequate to achieve universal health coverage. As for instance, primary healthcare spending as a percentage of total health expenditure did not increase in the recent years. Civil society and communities repeatedly highlighted in our consultation the need for increased public funds for the health sector, especially to support primary health care. So governments should prioritize and optimize budgetary allocations to health by investing in health systems strengthening based on primary health care and ensure adequate domestic financial resources to achieve universal health coverage. move together, which is relevant to the accountability and also multi-stakeholder engagement in the policy processes. Few countries have a formal, effective accountability mechanism for UHC, and the engagement of multi-stakeholder is inadequate. The majority of monitoring and evaluation activities focus on disease or program-specific areas, and there were the less attention has been paid to more comprehensive or integrated scales or indexes such as the service coverage index and financial protection, which are relevant to the SDG targets 3.8.1 and 3.8.2. So it's really important to have a monitoring and accountability mechanism in countries. Civil society and communities also emphasize the limited space for non-state actors to participate in government accountability efforts. So governments should promote participatory, inclusive approaches to health governance for UHC, including by enhancing a meaningful whole of society approach and social participation. All relevant stakeholders should be involved in the design, implementation, and review of UHC to meet potentially unique individual and community needs. So gender equality, this has been a really important issue and also has been incrementally concerned, especially after the COVID-19 pandemic. Women represent the majority, almost 70% of the health and care workforce. However, gender inequality exists in the health and care workforce and health leadership. Nevertheless, very few countries which we reviewed have expressed commitments to achieving gender equality in the health and care workforce and to increasing women's representation in overall political leadership for health. Governments should mainstream gender perspective into all aspects of health systems in order to achieve gender equality and increase the empowerment of women and girls by developing the gender responsive health systems. And this is also beneficial for all population groups. So this is the last commitment area, emergency preparedness. As we all know, the health emergency represented by COVID-19 pandemic demonstrated that underinvestment in resilient health systems results in catastrophic human costs when a crisis strikes. And also it disproportionately affects the most vulnerable populations and wide existing health inequality. However, as I a little bit introduced in other key commitment areas, countries do not invest sufficiently in health systems strengthening based on primary health care to achieve both UHC and health security. It is important to recognize that these two, UHC and health security, are intertwined goals achieved through the same national health systems. So governments must reaffirm the link between universal health coverage and health emergency prevention, preparedness, and response by recognizing that health system resilience and UHC are essential even for effective, sustainable prevention, preparedness, and response to future pandemics and other public health emergencies. So during UHC Day, and of course beyond, your roles and contributions at the global, regional, national, and local levels, at all levels, for health systems strengthening based on primary health care towards universal health coverage are really vital in order to mobilize political leaders and hold them accountable for acting on their UHC commitments. So please utilize our UHC 2030 resources, which you can find on our website, including this report, which is going to be published tomorrow, and also country profile dashboard introduced soon. And also our UHC action agenda, which is a set of action-oriented policy recommendations for health system strengthening. So let's work together in order to keep this UHC as on the highest political agenda. Thank you very much for your kind attention.
Thanks very much, Shohei, for a fantastic overview of those key areas and for summarizing each one so concisely. So you all saw on Shohei's slide and in his presentation that as part of this state of country UHC commitment country review, we've created a country profile dashboard, which allows you to look at the specific UHC data for your country and to use that for evidence-based advocacy. So I want to introduce Waiswa Nakwanga, the coordinator of the CSEM and a senior technical advisor at Management Sciences for Health, who's going to share with us a brief demo on how the country profile works so that after the webinar, you can go and look up your own country or regional data and use them for your advocacy. Over to you, Waiswa, and welcome.
Thanks, Amy, and thanks, Shohei, for the great presentation. So this is an additional piece that complements the synthesis report that is more global. This here, if you're looking at my screen, you can see that we have a tool where you can go and look at a country of interest that you're interested in knowing, maybe one country, maybe another country, where you want to know how they're performing or doing against some of the areas, commitment areas that Shohei just presented about. So the political leadership, legislate and regulate, point of care, move together, accountability, leave no one behind. And this tool allows you to sort that through based on available data. We don't have all the data for all the countries. We have data for about 139 countries, and some pieces may not be there, but we do have some data that you can use to see how countries are doing against that. It also allows you to look at how your country, a particular country, compares with other countries in the same kind of like income level. So here, just to give you an example, if let's take a country like Thailand that we know that has done pretty well in terms of UHC, and we want to see, if you were an advocate, you want to see what's going on in Thailand. This gives you an overall picture of what areas Thailand, as you can see here, is doing great at, and then what are the areas of improvement and financing, but still probably about the same or higher than the averages of countries with comparable income level. And on the right here, you can look at which areas. So we have three areas: have political will, we have institutional reform, and then you have implementation. So you can sort here to see in what area a lot of the a lot of achievement has been made. So here you can see it's a lot in implementation, and we don't see very much on the political will side of things. And then here it gives you more details. It's this is looking at from 2005 all the way to 2021, and you can read more in this box here on specific targets and milestones. When you scroll down, you can see there are many different measures you can look at. You can look at service health, so coverage of health, essential health services, and you can see that most of the of the coverage is in the MCH, and for other countries it will be different. Once you enter the country, all of this will shift and show you how that country is doing in those areas. Down here, you can look at, if a country has a UHC strategy, if it has UHC as a goal of national health policies, as if it has a UHC law and all of the other indicators that you might be interested in. And then when you come down here, in the interest of time, I will look at this piece and then another area. But here you can see it will show you where a lot of which populations are most kind of like covered or most focused on by the government. And here for Thailand, you can see it's people living with HIV. If you switch to a different country, it might be different. And so here you can you were able to see that. If you come down here, this is an area that interests me a lot on social participation and public perception, and then women participation and leadership, something that we covered, or Shohei just covered in the presentation. And you can see here in the minister's side here, for other countries, you see some percentages here, but for Thailand, not very much here. And then you can also sort it to see in terms of their their legislative bodies. You can see for Thailand it's quite low. And then you can look at the healthcare workforce as well here. And you can see that in probably the decision-making area, or the physicians and others probably not doing as great as we would hope, want to see. And so this tool is for you to use to shape your advocacy. You look at this and it gives you a sense of how you interact with your decision makers, what you want to ask them to do better, what you want to commend them for doing well, and have this information inform how you engage with your heads of state. This data, as Shoei shared, is pulled from national health strategies and plans, and the voluntary national reviews, the other sources that we use to compile the global synthesis report, as well as civil society data. So it's please use it. We'll share a link in the chat shortly if it hasn't been shared yet. But we encourage you to use this tool because it's very useful for your advocacy. Thank you. Back to you, Amy.
Thanks, Waiswa. And yes, the links have been shared in the chat, both to the portal itself and to a video that shows you in a little more detail what Waiswa just went over, how you can use and understand and access the different pieces of the report. So we encourage you to check that out. And Waiswa, I know you were presenting, so you couldn't see it, but lots of appreciation for the tool in the chat. We're really excited to have those specific profiles and appreciate UHC 2030 and all of the others that supported pulling that data together, again, that we can all use for our evidence-based advocacy. So as you've heard in the presentation from Shohei and a little bit of our overview, countries are in very different places in terms of achieving their UHC commitments. And our panel discussion today brings a fantastic cross-section of very experienced advocates to the stage to talk to us about about the theme of today's webinar, how we move from those global commitments that Shohei just reminded us about into action at the country level and at the regional level. I'm very pleased to welcome our panelists to the virtual stage. I will introduce them all now, and then we will spotlight them. Because of the interpretation, we're trying to not have 4 or 5 people on the screen at the same time so that you have good visibility for the sign language interpreter. So let me go ahead and introduce them now, and then I'll call them to the stage as I ask them each a question for reflection. We're delighted to be joined by Carmen Ryan, who is the Public Advocacy Coordinator and Public Policy Implementation Supporter at Fundación Huésped, based in Argentina. Carmen is a lawyer by training, and over the last 15 years, she's been working to help civil society organizations, international organizations, and public offices on different human rights projects. Carmen is a member of the core committee of the Social Participation for Health, Engagement, Research, and Empowerment, otherwise known as SPHERE initiative, which brings together civil society representatives, multilateral agencies, implementers, and academics in the service of health reforms on UHC. And we're very pleased to have you here, Carmen. Our next speaker is Denis Godlewski. He's a co-founder and board member of the Health Advocacy Coalition, a nonprofit organization promoting UHC principles in Eastern Europe and Central Asia region. He's also a regional coordinator for the International Treatment Preparedness Coalition in the region, a network of activists advocating for access to life-saving HIV and TB treatment, HCV and TB treatment and services. And Denis is a member of our CSEM advisory group. Welcome, Denis. Thanks for being here. We also have with us today Maxwell Antwi, who is a country director at Farm Access Foundation and a member of the WHO roster of experts on digital health based in Ghana. Before joining Farm Access, he worked for over a decade in senior capacities within and outside the Ghana Health Service as a specialist obstetrician gynecologist, healthcare manager, and a public health professional. He is also a member of our Civil Society Engagement Mechanism Advisory Group. Welcome, Maxwell. And finally, we're pleased to welcome Nupur Lalvani, who is the founder director at the Blue Circle Diabetes Foundation, a registered nonprofit organization that works in diabetes awareness and advocacy. Blue Circle Diabetes Foundation is India's largest community-led support group for people living with all types of diabetes. Nupur herself has lived experience of having type 1 diabetes since 1996 and is a certified diabetes educator. She's also a member of the CSEM Advisory Group and one of our civil society representatives to the UHC 2030 Steering Committee. So thank you again to my panelists for being here. Nupur, I'm going to start with you. If we can bring you to the screen and the stage. Welcome. So we've spent the beginning of this webinar talking about the fact that progress on UHC is off track. And now we'd like to hear a little bit from you and your experience and your perspective about what steps government should be taking to translate those commitments into concrete actions and to expand service coverage for the most vulnerable. I know as a non-communicable disease advocate, that focus on leaving no one behind is very important in your work. So please share with us some of your perspectives from your work in India and the region. Over to you.
Thank you, Amy. Thanks for having me here. You said this at the beginning, there are 4.5 billion people that still lack access to essential healthcare services in the world, and billions really face financial hardships to access the quality healthcare that they really need. We are all of us, all our countries, the world is not on track at all. We know this, and we saw it in Shohei's presentation as well. And we know that this stagnation in UHC calls for immediate action by all of our governments. So I have three broad sort of points that I'd like to make. And the first one is financing. Our governments need to prioritize financing of primary healthcare. We all know that primary healthcare is the cornerstone of universal health coverage. And it's not just about allocating the needed funds, but also about making sure that they're used effectively. And strengthening this whole system of PHC is really going to broaden the service coverage and make sure that the most vulnerable of the population and marginalized groups that don't have a voice are also taken care of and have access to the health services that they need. Secondly, governments must also focus on integrating health services with social protection schemes. There are a lot of people that face financial hardships and which are associated with healthcare costs, and they often have to make decisions about healthcare and whether to whether they can afford a day's meal or they should really go in and see the GP. Decisions like these nobody should have to make, and this can be done only if governments expand the coverage that exists in the country and implement policies which reduce the catastrophic out-of-pocket spending. And there are several studies and papers to that talk about the catastrophic out-of-pocket spending that people have to face. Finally, I want to talk a little bit about the partnerships and accountability as well. Governments need to foster partnerships with civil society organizations with the same fervor that is used for large international organizations and with the private sector as well. As civil society, we are really the bridge between governments and communities and marginalized sectors of people, and our rich experience as civil society organizations and communities can really help make the government understand as well where they need to fine tune and where they need to tweak. And, I can share a quick example here. India has 150,000 primary healthcare centers that are now rebranded as health and wellness centers. And while that's a very positive step in the right direction, as a person living with an NCD, I still cannot access my insulin through one of these primary healthcare centers. So there's a lot to be done in various fields, and we've seen there are some wonderful examples of civil society engagement, such as Thailand, and Vaiswa shared that through the portal as well a while ago. So I think I'll pause here, but these were my 3 broad points. Thanks, Amy.
Fantastic. Thanks, Nupur. And I love that image of civil society as a bridge between the policymakers and those decision makers at different levels in the government and in the community. Thank you so much. Maxwell, I'm going to turn to you with a similar question related to those concrete steps you may recommend governments to take. I knew you do some particular advocacy in the digital health space and are working in a number of coalitions there in Ghana. Please share your perspectives with us on this important accountability work.
Amy, thank you. And Nupur has shared some great thoughts on what governments could do to move this forward. Our colleague Vaiswa, just a few minutes ago, introduced our audience to the state of commitment to UHC at the country level. When you analyze the 2023 Global Monitoring Report, there's a striking trend. You would realize that only 42 countries globally have improved both service coverage and reduced out-of-pocket spending for health. Now, the question is, what is the cross-cutting strategy that these 42 governments have been able to implement, and how could that possibly serve as a blueprint for other governments to emulate and take forward? And one of the cross-cutting strategies you will find is that those 42 countries demonstrated strong political commitment to UHC. So if you analyze them, you realize that they really implemented strategies that reduced out-of-pocket health spending and also increase service coverage. They embedded these in their national development and health plans. And not only did they embed it in the national development plans, but they actually walked the talk. So one of the first cross-cutting strategies that will encourage all of us to advocate our governments is to have a strong political commitment. If it means these items ending up on political party manifestos, we should advocate for that. The second cross-cutting strategy you'll find among these 42 countries is that they all have a very comprehensive package of essential health services. And these health services are equitable and inclusive. So governments need to review their essential health service package and make them more inclusive and more equitable. The third strategy you'll find across all these 42 countries is that they limited out-of-pocket health spending and exempted the poorest of their populations. So, and they adopted different mechanisms. Some of them use premium-based health insurance. Some of them use tax-funded health financing schemes. Some use the blended approach. But the cross-cutting trend is that they take steps to limit out-of-pocket health spending and exempt especially the poorest of their population. The fourth cross-cutting strategy you'll find among these 42 countries is that they use public funding efficiently and avoided waste. And especially in low middle-income countries, especially in Africa, it's an area where we as civil society should really pay attention to what value of health outcome is being derived for every shilling, every naira, every euro, every dollar, and every cedi invested in health. And then the last I would mention, cross-cutting strategy you find among these 42 countries is that they use data. So they invest in data and they analyze their data and the decisions that they make and the policies that they make are data-driven. The data is primary data and is granular enough to help them to make key decisions. So it's not rocket science anymore. Others have done it, and we should encourage other governments to also do that. Amy.
Thanks, Maxwell. And while you were speaking, it made me think you were starting talking about political will. And it made me think about something that WHO Director General Tedros said during the high-level meeting on UHC in September. He said, ultimately, universal health coverage is a choice, a political choice. And the political declaration that countries approved was a strong signal that they were making that choice, but the choice is not just made on paper. And so it is about, thank you for lifting up the ways that different countries have taken action to prioritize around funding, around out-of-pocket costs, around political will, more money better spent. Appreciate that perspective and that analysis. I'd like to turn now to Dennis. Dennis, as I mentioned in your intro, you lead advocacy networks in your region in Eastern Europe and Central Asia. And I wonder what you've seen, what you can share with us about the important role of civil society and communities in really driving implementation of UHC opportunities, and share with us, UHC commitments, and share with us a little bit about the opportunities and the challenges that you and your civil society partners are facing in the region. Over to you.
Yeah, sure. Thanks to everyone who has joined us. And thank you for giving me some time to share my ideas and what I have observed. I think that the fact that we have now, in the time after the adoption of the political declaration, itself provides us with a lot of advocacy opportunities, because now is the great time to take a look at the previous monitoring report that was released in 2019 and look at the new monitoring report that was released now. For each of your country, for each of our countries, we can take a look and compare what is the progress, if any, are we reversing? And then also, I think UHC 2030 and CSM are providing several great advocacy opportunities and like practical instruments. Like the first of which I would like to talk about is the Health for All Advocacy Toolkit. I don't think it was yet mentioned today, but I think it's a great one. It's available on the website. And I hope colleagues can drop the link here so that you could use it. It's available in English, French, Spanish, and Russian. So this is a very practical toolkit that both educates you and helps you to think of the practical steps that you can do at the country level and at the regional level. I think the other great opportunity for civil society also is the methodology that was developed by UHC 2030 and the civil society engagement mechanism on the research that can be done, the survey that can be done among civil society groups in the country, where you can evaluate the progress and the vision of the civil society groups towards the UHC, and then describe them in a meaningful report. And then you can use this basically shadow report as an advocacy tool in negotiations with the decision makers, negotiations with donors, as like a very specific evidence-based tool to do pitching for funding and to advocate for like specific issues. Because I think we're really in challenging times in our region as well. And one of the challenges, I think, but it's represented even in our meeting, that unfortunately, due to lack of resources and also due to political issues, sometimes like Russian language is underrepresented, and the reports and translations, but not only to Russian, but to all the UN languages, are being delayed. And we can see that from WHO, from UN agencies, that some documents we can see in our native languages and the regional languages in like a year or two after they were released in English. And I think for grassroots communities, this is a very important thing to be aware. So like delivering this information via webinars like this one, with the interpretation via production of the documents, information at the native languages for our communities, this is very important and would be very beneficial. I'll stop here so far.
Thanks, Dennis. And I want to recognize your support and the support of your coalition in making many of the tools, including also the action agenda that was used for advocacy around available in Russian. We try our best to be inclusive in these webinars and the way that we share our materials, but of course, as you're highlighting, it's a challenge to have those materials available in all languages and local languages. We certainly look forward to partnering with other members of the CSEM to expand availability, or to do regional or country level presentations as we've done in the past, to help bring not only the advocacy tools, but also the actual political commitments in those languages so that we can use them more effectively to advocate with our leaders. Speaking of sharing messages in another language, I'm going to invite Carmen to the floor now, and Carmen will be responding to my questions and making her comments in Spanish. So please be sure to go to the globe icon at the bottom of your screen and select your preferred interpretation language if you don't speak Spanish, so that you can listen to Carmen's important interventions. So Carmen will give everybody a moment to get their interpretation together. Thanks for being here with us today. Fundación Huésped leads work with civil society, similar to what I was just discussing with Dennis in the region. And I wonder if you can share with us a bit about the important role of civil society in advancing universal health coverage in your own country, in Argentina, and across the region, and a little bit about how you engage in that work. Over to you.
Muchas gracias, Amy. Muchas gracias a todos y todas por la paciencia de cambiar a la interpretación y escucharnos en español un ratito por hoy. Bueno, ante la pregunta de pensar cómo desde la sociedad civil impulsamos la cobertura universal de salud, nos surgen un montón de reflexiones desde la Fundación Huésped. Y en esas reflexiones que aparecen, una de las primeras es la diversidad. Cuando pensamos en los compromisos en materia de cobertura universal de salud, todos los países asumen compromisos similares desde contextos muy diversos. Desde contextos muy diversos en que las políticas de salud se implementan de manera diversa, en que el financiamiento es diferenciado, en que el acceso a ciertas políticas gratuitas o no es muy diferente. Y entonces tenemos que recuperar algo que es un poco un viejo concepto, ¿no?, del mundo de los derechos humanos, que es la mirada de progresividad, de que esos compromisos son un piso que tenemos que pensar cómo se ajusta a nuestro contexto y cómo nos permiten avanzar más fuertemente hacia la salud para todos, la salud para todas las poblaciones. Y ahí, si pienso en el rol de sociedad civil, creo que lo más importante que hacemos, aunque a veces nos cueste dedicarle tiempo, aunque a veces nos cueste ver el impacto concreto de esa acción, es mantenernos conectados. La sociedad civil también es un espacio muy diverso, muchas veces, o por lo menos en América Latina nos pasa, perdón si voy rápido para la interpretación, me hacen señas, pero nos pasa que estamos organizados por patología. Fundación Huésped es una organización que nació y creció trabajando por una respuesta más efectiva al VIH. A lo largo de los años hemos incorporado en nuestras agendas la salud sexual, las enfermedades prevenibles por vacunas, pero aún tenemos un foco muy temático. Y nos pasa en la sociedad civil latinoamericana que estamos todavía pensando en nuestro trabajo desde un foco temático. Nos cuesta mucho superar las barreras de nuestras agendas, de nuestros temas, y poder reconocer que la cobertura universal de salud, que el acceso a un mejor sistema integral de salud va a ser más efectivo para todos. Aun cuando lo vemos en nuestro trabajo diario, nosotros sabemos que sin un buen acceso a servicios de salud mental efectivos, las personas con VIH no logran una buena adherencia al tratamiento, y que sin una buena adherencia al tratamiento se ven expuestas a otras patologías como la tuberculosis. Lo vemos en nuestro trabajo diario, pero cuando pensamos en cobertura universal de salud, cuando pensamos en esa agenda tan global y tan grande que es desafiante para los estados, también encontramos un desafío enorme para la sociedad civil, que es superar nuestras nuestras agendas específicas y encontrar la manera de conectarnos, encontrar la manera de pensar cómo podemos unir nuestras voces, unir nuestras reflexiones, unir nuestras preocupaciones que tienen muchas similitudes y pensar cómo un sistema de salud inclusivo, efectivo, de calidad, accesible económicamente. Hoy en Argentina volvemos a discutir, durante muchos años decíamos, para Argentina la cobertura universal de salud es una conversación compleja porque tenemos un sistema público de salud y tenemos que discutir cómo mejorarlo, cómo hacerlo más efectivo y más accesible. Hoy estamos discutiendo nuevamente si ese sistema debería o no arancelizarse y han ganado posiciones en los congresos y en los ejecutivos en las últimas elecciones, sectores que plantean que deberían cobrarse por cada uno de los servicios. Y en esa conversación, en ese desafiante diálogo en donde pensamos en cajitas, necesitamos encontrar la manera de ver cuáles son las barreras que son universales, cuáles son las dificultades que nos afectan a todas las organizaciones que trabajamos por patología, que en síntesis estamos trabajando por las comunidades más desaventajadas.
Thanks, Carmen. I'm giving the interpreter a moment to wrap up on that. Thanks for highlighting to us the importance of our little boxes and working on the overall health system strengthening advocacy agenda, thinking about that that joint advocacy. And I think that's relevant across the regions where all organizations tend to advocate in one way and think about that kind of inclusive, equitable push for overall health systems in UHC. I have another question for you. As I mentioned in your introduction, it's been a real pleasure to work with you on the SPHERE initiative, which is a social accountability focused initiative. And we're excited that in May of 2024 at the World Health Assembly, there will be a resolution put forward on social participation. And I wondered if you could talk a little bit about, to share with those on the webinar, why that's important in terms of driving the implementation on UHC commitments at the country level.
Gracias, Amy. Me parece una pregunta súper valiosa y súper interesante, porque cuando pensamos en participación, de vuelta nos aparecen un abanico de posibilidades. La participación social en promover mejoras en los sistemas de salud se ve de diferentes maneras. Se puede ver como una multi-stakeholder hearing en Naciones Unidas, en donde nos encontramos en ciudades diferentes a las nuestras, hablando idiomas que no son los nuestros, con tomadores de decisión que tienen urgencias muy diversas, o se puede ver como una navegadora par de la comunidad transgénero de Argentina que acompaña a una persona que enfrenta barreras de discriminación para que pueda acceder efectivamente a su turno de salud y para que pueda exigir ser tratada con su género autopercibido y efectivamente acceder al sistema de salud. Entre esos dos extremos de participación tenemos un abanico de posibilidades de diferentes niveles de escucha, de diferentes niveles de apertura, de diferentes niveles de comunicación, de cómo entablar un diálogo para entender cuál es el impacto real de las políticas públicas, cuál es el impacto real de los sistemas de salud en las comunidades. Desde el mundo del VIH sentimos que hemos adquirido un aprendizaje que necesitamos compartir con el resto del sector salud, que es que las poblaciones clave, las poblaciones más expuestas al virus necesitan ser el foco de nuestras políticas públicas. Y ahí hay un error en el que muchas veces caemos. Esas poblaciones no están más expuestas por sus prácticas, están más expuestas porque se encuentran excluidas del sistema de salud, porque enfrentan barreras específicas, y la única manera de superar esa exclusión, la única manera de lograr que el sistema de salud les dé la bienvenida, les permita acceder a los servicios, es conversando con ellos, es conversando y entendiendo qué es lo que los excluye. Cuando dialogamos con trabajadoras sexuales y entendemos cuáles son las barreras, cuáles son los limitantes que encuentran en el sistema de salud, y nos explican por qué nunca asisten a medicina preventiva, por qué nunca asisten a los servicios de salud sexual, porque se enfrentan barreras de discriminación y planteos sobre la necesidad de cambiar su trabajo, que es algo que no están yendo a buscar, están yendo a buscar un servicio de salud, empezamos a comprender la necesidad, y lo planteo con trabajadoras sexuales, nos pasa con personas transgénero, nos pasa con personas privadas de libertad, nos pasa con hombres que tienen sexo con hombres, nos pasa con la comunidad LGBTIQ en general, nos pasa muy fuertemente con la comunidad campesina, con las comunidades rurales, con las comunidades indígenas. Aquí yo hoy elegí hablar en español un poco como un mensaje político, pero las barreras de lenguaje son una barrera enorme para acceder a servicios de salud. Y es verdad que generar esos espacios de diálogo, que generar esos espacios de escucha, de entendimiento, requieren muchas veces de intérpretes, como hoy necesitamos intérpretes para que yo pueda hablarles en español. Requieren de intérpretes porque los profesionales de la salud, porque los especialistas en diseñar políticas sanitarias no necesariamente son especialistas en cada una de las comunidades que enfrenta barreras. Y muchas veces necesitamos esos puentes que decía hace un rato Nupur, ¿no? Y esos puentes podemos ser la sociedad civil, pueden ser los colegas del espacio de trabajo social, pueden ser diferentes referentes. Pero también necesitamos tiempo. Y sabemos que el tiempo es muy costoso. Pero hay algo que nos parece muy importante decir, que es que las políticas públicas, si no son participativas, no alcanzan a las comunidades que necesitan llegar, y eso es muchísimo más costoso. Una política pública que es ineficiente, que no logra alcanzar a las poblaciones clave, necesitan muchísimo más, un gasto mucho más innecesario que una política pública que invierte en el principio, durante la implementación y en la etapa de evaluación en participación adecuada. Por eso nos parece que este primer compromiso en materia de participación, perdón, di muchas vueltas para llegar, pero este primer compromiso a nivel de la OMS en materia de participación nos plantea, como todos los compromisos globales, eso, ¿no? Un norte, un piso, un lugar en donde pensar a futuro. ¿Cómo estamos participando en nuestras comunidades en los distintos espacios en donde se definen las políticas de salud? ¿Cómo podemos mejorar esas instancias de participación? ¿Qué canales y qué posibilidades tenemos? ¿Y cómo podemos monitorearlos más efectivamente para profundizarlos? Por supuesto que es una resolución que es la primera y que nos va a dejar con muchas ganas de más. Pero es un avance enorme.
Thanks, Carmen. And for anyone who's interested in more information on the World Health Assembly resolution, it's available in the chat. And Carmen, I appreciate that it took you a little while to get to the WHA resolution, because it was more important to think about why social participation is so crucial, because the healthcare providers and the policymakers, and none of us are experts in the lived experience of all of those communities. And thinking about how we bring in those voices, there's also a comment in the chat about the importance of thinking about people who are living with disabilities and the discrimination that they face, all of the many different communities that have challenges evident and hidden sometimes around discrimination and challenges for accessing those health services. Muchas gracias por compartir su punto de vista y su pasión. I see there are a few questions have come up in the chat and have already been answered by some of my colleagues. So I appreciate those of you behind the scenes who are responding to some of the requests for additional data, questions on how often the UHC profiles are updated and where other resources can be accessed. There is one question around whether there's a particular research agenda on UHC that has been developed to guide CSOs in their advocacy. I think that was asked of Dennis, but it's actually a question for any of you. I don't know whether in your work there's a particular research agenda that you want to highlight, but I'll open it up for that question before we turn to actions for UHC Day. Any of the panelists want to come in on that?
I don't think there is a particular research agenda developed at the global level by anybody, because I also frankly believe that to the extent that we need to have a global movement, and that's important to have common advocacy goals, this is also the area where devil is in details. And for each country, Or for each sub-region, let's say for Eastern Europe and Central Asia, you might consider as the United Region, but in fact, there are Central Asian countries like Kyrgyzstan, Kazakhstan, Uzbekistan, and the agenda for them at the moment would be very different for the agenda for countries like Ukraine, which has a totally different perspective of challenges, especially bearing in mind that the full-scale war and invasion from Russia, and Russia has another set of issues in the country. So it's very important to rely on the needs of the grassroots communities with this regard of the development of any monitoring, community-led monitoring or research. And for us, the priorities has been to make sure we are making a survey and asking the community organizations, those who are working in HIV, TB, hepatitis, working in the rights of LGBTQI, on what is their perception of the implementation of UHC principles on achievement of UHC indicators. And I think this is one of the key issues for us as like a civil society voices, because we can go on the ground, pick up those voices, as was mentioned by our colleagues, and bring it up to the global level. This is very important.
Thanks, Denison. That's a lot of what we did in the State of UHC. In informing the report, we held over 40 country consultations to bring those community voices into the global data. Maxwell, over to you.
Well, thank you, Amy. So the experience we've been having, especially in the Sub-Saharan Africa, is that countries have started developing their own UHC roadmaps. And in the country level roadmaps, they've included metrics that need to be monitored. And the advocacy now is, how do we integrate academia and independent researchers who can do the actual research and in a very transparent and accountable manner be able to report to the governments how well we are doing and where there are gaps. Otherwise, the governments become their judges in their own court and may not be able to hold their own feet to the fire. So that's the next layer that we need to push.
Yeah, it's a part of not just relying on the country self-reporting that happens very UN circles. Carmen, over to you.
Les doy un minuto. I'm giving you just a second to switch to Spanish for anyone who needs to. Quería traer una experiencia que me parece muy destacada en materia de investigación. La comunidad trans en Latinoamérica ha logrado avances significativos en lo que es investigación liderada por las comunidades, y ahí me parece que hubo dos pasos que fueron claves para lograr la más intensa participación, si bien todavía falta muchísimo, pero la más intensa participación que están alcanzando en algunos segmentos de investigación sobre sus temas de salud. El primero creo que tiene que ver con asegurar instancias de devolución de las investigaciones que involucran a la comunidad. Cuando participan como sujetos de investigación, exigen instancias de devolución muy profundas, y creo que eso ha permitido lograr que su involucramiento no se limite a la etapa de investigación como sujeto investigado. Y ahí creo que han logrado una conexión, el handbook que hablaban hace un ratito, el manual de trabajo sobre incidencia pública que ha hecho el CSEM es un buen ejemplo de eso, una muy buena conexión entre las agendas de investigación y de incidencia que necesitamos profundizar mucho más. Y después otro punto en el que han trabajado muy bien y que a mí me parece que es valioso para pensar y para pensarlo con otras comunidades es la formación de investigadores dentro de las comunidades, que con perfiles y trayectorias muy diversas se incorporan para el trabajo en focus groups, para el trabajo en toma de encuestas, y han cambiado muchos de los desarrollos. Tenemos todavía muchísimo trabajo para hacer, muchísimo trabajo para lograr una agenda de prioridades de investigación que tome las prioridades de las comunidades primero, pero me parece que ahí hay algunas experiencias. Desde SFIR constantemente estamos tratando de mostrar las experiencias de avance, porque a veces cuando pedimos más no sabemos exactamente cómo debería verse eso, y nos parece que ahí hay alguna posibilidad de cambio.
Thanks, Carmen. We're getting to the end of the webinar time that we have together, but I just want to hand over to Laura Philidor, who opened us up today. She's our Advocacy and Communications Officer for the CSEM based at Wacky Health, to give us a few tips on how you can get engaged in Universal Health Coverage Day before we close. Laura, over to you.
Thank you so much, Amy, and thank you everyone for this very insightful conversation. We might finish a bit later than expected this webinar, but I really do think that sometimes we just have to take some time to discuss, to move ahead together, and to just keep forward in our advocacy plan. So thank you so much for sharing all this precious information. We won't have time to pass a few minutes on that. Sorry, but you can find a link in the chat also, a Menti link, when you can add your key takeaway from this discussion. Let us know what we should be prioritized in your country to make progress on UHC. I see already that some people have shared some great words. So it's 1 or 2 words. Is it, like Carmen was saying, diversity? Is it visibility, increasing funding, social participation? So feel free to add, and the link will be available after the call too. But that will be great to just raise our voice together and bring civil society in the front for UHC Day. In the interest of time, I will go to UHC plan, if my screen is okay with that. To conclude also on this conversation, you can find several resources on CSEM websites that are globally available on our CSEM UHC Day 2023 pages. You can find the action agenda, the political declaration on UHC, and a briefing note from civil society. This is a key document to analyze the outcome of the political declaration on UHC, a short one with next step, with a quick analysis of the weaknesses and strengths to be used widely. You also have the 2023 Global Monitoring Reports and a civil society commentary on what is missing in that to include everyone and leave no one behind. And finally, the advocacy brief towards a WHO resolution on social participation, of what Carmen was greatly talking about. If you want more information, more background information, more opportunities to be involved, this is the document you need. Great. So before closing, so as you know, we are on the 6th and UHC Day is on the 12th. And this year, our word is time for action. Now that this commitment have been adopted, what should we do to implement that in country and make progress on UHC? For that, there is 4 points I will quickly go over. First, you can participate into the Champions campaign this year. So usually it's to bring more visibility to the UHC subject. And this year, there is 2 prompts. One for policymakers. We want to ask them what meaningful step they will take right now to act on Health for All and on progress towards UHC. If you ever are in contact with your minister, your head of state, your parliamentary, your every policymaker that you know, feel free to put that in the chat or email us or directly contact him or her or they, and we will make sure that they can participate. There will be also some other prompts for influencers in what meaningful step should leader take right now. So you understand it's calling leader to act at this stage. So you will see many quotes and video popping out, so stay tuned. Also, we know that many of you are organizing events for UHC Day. So if that's the case, please click on the UHC Day website. We'll share the link on the chat, and if not, you will receive a recap email after this webinar. But just telling us when is your event, if it's online, if you have any social media on which everyone can promote it, that's really helped to strengthen the UHC Day movement. Also, this is not the only event that will be happening, and there is another important one that we will like to promote. It's the official town hall on UHC that will be happening just before UHC Day on the 11th of December. This is online. You will meet again a translator here that will be translating in Spanish, French, international sign languages, and the aim will be to gather youth advocates, UHC campaigner, parliamentarian, and having a conversation between youth campaigner and the parliamentarian. And the youth will be able to ask for action, to ask questions to parliamentarian in what they are planning to do on UHC. Finally, there is a lot of tools that you can use also ahead of UHC Day to raise the momentum. So many of these events are now past. There is also the Human Rights Day on 10th of December, so you can find some social media toolkits, text, images that you can widely promote. And of course, on UHC Day itself, you have many graphics. You can find a slide template that we use for this webinar. So if you like it, download it. We have many quote cards. There's many documents that you can use just to save some time and be the most effective as we can. Great, I will let over Amy to conclude this webinar, but if you want to be more involved with us, please join us on CSEM to become a member and to receive all the information. Follow us on social media, and we have a UHC Day 2023 website page. So if you're lost in all this link, you will find this all in this webpage. Thank you, everyone. Amy, I'll let you conclude this webinar.
Thanks, Laura. What a great way to kick off the week leading up to Universal Health Coverage Day. Thanks, everybody, for your participation. Please join me in a virtual round of applause for my panelists, my colleagues, and particularly for the interpreters and others behind the scenes who work so hard to make this engaging webinar possible. Thank you for being here. We look forward to seeing you at our next Universal Health Coverage Day event. Have a great one. Thanks.